Hi, my name is Mary Lenox, and I'm clinical dietitian at Pella Regional Health Center. I want to talk to you about foods with potassium. Have you ever tried to reach and got a cramp? I have, and it's not fun until it goes away. Potassium is a key mineral that's in every cell in our body, helping nerves and muscles communicate. It also works with other minerals to help our muscles contract and to help maintain normal blood pressure, among other things. According to the most recent dietary guidelines for Americans, potassium is considered an under-consumed nutrient and is a public health concern. The daily value for adults and children ages 4 and above is 4,700 milligrams a day. 4,700 milligrams a day may seem hard to achieve, so I want to show you how you can meet that goal. So here are a few examples. Starting out with breakfast, we've got raisins for 618 milligrams, a banana for 420 milligrams, and then for lunch, there's salmon for 326 milligrams, a cup of spinach for 334 milligrams, a cup of chopped tomatoes for 420 milligrams, a cup of carrots for 390 milligrams, and then for dinner, 3 ounces of chicken breast for 332 milligrams, a baked potato for 930 milligrams, a cup of broccoli for 460 milligrams, and an apple for 195 milligrams, and then a cup of milk for 350 milligrams. So when you add them all together, you get 4,785 milligrams a day, and you've met your daily requirements. By meeting your daily requirements, it can help reduce your risk of stroke, heart disease, or high blood pressure. For people with chronic kidney disease or kidney disease, those guidelines won't work, so you'll probably want to talk to a renal dietitian. To help consumers feel more knowledgeable about potassium content in foods, the U.S. Food and Drug Administration, or the FDA, developed and edited their Nutrition Facts panel to include potassium per serving. Protect yourself every day by trying to get 4,700 milligrams a day and avoid the cramps. Thank you.